All right, am I visible? All right, wonderful. So I'm going to be doing the head to toe. This is Carl Spanigal. Here's the first sheet of my paper. Is that visible? There's no writing on that. And then on the back side, no writing as well. And that side. And then on the third page, no writing. And then nothing on the back as well. So there's no writing. And I'm going to set this aside face down. First, I'm going to start by washing my hands. Hi, my name is Carl Spanigal. I'm going to be your student nurse today. Can I get your name and date of birth?
Hello, my name is Ian Spanigal. I was born on 11/24/2005.
All right, wonderful. I'm going to be asking you a couple of questions, so just bear with me. Can I get the location of where we're at right now?
We are currently at our home in Saginaw.
All right, wonderful. And can you tell me who the current president is?
Biden.
All right, wonderful, wonderful. I'm going to gather a brief health history of you before I start my head-to-toe assessment. So I'm just going to ask you a couple of questions. Are you all right with that?
Yep.
All right, so the first question I got for you is, do you have any allergies?
Nope.
All right. And do you have any past medical diagnosis or current medical diagnosis that I need to know about?
Scoliosis.
Scoliosis. All right. And have you had any past surgeries at all?
Nope.
No surgeries?
Nope.
All right. Wonderful. And are you taking any medications currently?
No.
No medications, no over-the-counters, herbals, supplements, anything like that at all?
Nope.
All right. Wonderful. And do you have any important family history that I need to be aware of that you're worried about at all, such as diabetes, anything like that?
Nope.
All right, wonderful. Couple more questions. Just can I get your can you give me an idea of how often you exercise, what your activity level is?
Like 3 days a week.
All right, and then how good is your diet? Would you say you get your full 3 meals in every day?
Yes.
All right, wonderful. And lastly, have you ever drank or smoked?
Nope.
All right, wonderful, wonderful. I'm going to begin taking your vitals. Are you okay with that?
Yep.
All right, wonderful. I'm going to start off by assessing your heart rate. So I'm just going to listen for a full minute. I've got an Apple Watch on because my watch broke last minute. So I know this is unorthodox, but I have no choice because my watch broke. So this has just only got the second hand on it. All right, wonderful. So his heart rate for the first 30 seconds was 34 beats in the 30 seconds. So we multiply that by 2. We know that his heart rate was roughly, or basically, 68 beats per minute. And we know that his respiration rate, I did it for the other 30 seconds while he wasn't aware, just to make sure that his breathing pattern didn't change, and he did 8 respirations in those 30 seconds. So 16 respirations total in a minute, which is normal. So I'm going to begin taking your blood pressure. So let me grab my blood pressure cuffs. And do you have an arm that you prefer at all?
Nope.
All right, wonderful. I'm going to take your right arm, then. So I'm going to go right here, slide this up, just for a second, and lift up your arm just slightly. And make this nice and snug. All right. And is that comfortable?
Mm-hmm.
All right. And and I'm going to assess your blood pressure. Can you relax your arm for me? All right. Having a little bit of a difficulty with that. I'm going to give it one more try. All right. All right, wonderful. Your blood pressure was 124/80, which is perfectly normal. Next, I'm going to assess your oxygenation level. Briefly, we don't have an SpO2 sensor here, so I'm just going to look at your fingers, check for any clubbing, and I'm going to check your perfusion rate. I'm seeing no clubbing on this hand, and then on this hand. Wonderful. Next, I'm going to check the perfusion, and 1, 2. And each finger on that side is 2 seconds for capillary refill, under 3 seconds. And this side is 2 seconds as well. So I would assume your oxygenation rating would be around 99 to 100%. There's no way to tell for sure unless I have the SpO2 reader, but that's the best we got for right now. Have you been experiencing any sort of symptoms of like fever or hotness, sweating, anything like that?
Nope.
All right, wonderful. And have you been around anyone sick recently?
Nope.
All right, so we're gonna assume that your temperature, I don't have a temp gauge, like a thing to check your temperature right now, but we're gonna assume your temperature is around 98.6, which is normal. And yeah, we're ready to begin the assessment. So starting off, I am going to start by assessing your arms, okay? So I'm just going to take a brief look at your arms. I'm just going to be inspecting for any lesions, any abnormalities, any cuts, anything like that. I noticed you got a little scar here on your finger and a little bruise there. How did those get there?
This one is from a tire, and the one on my finger is from you when you slammed my hand into my finger in a door.
Right, I apologize about that. That is my bad. And is this one also from the tire as well?
Yep.
All right, I'm not noticing anything else. I'm just going to assess for muscle tone. All right, and everything is symmetrical. Muscle tone is normal. Next, I'm going to assess a little bit of range of motion. So I'm just going to have you move your elbows in a bicep curling motion. Are you experiencing any pain with that?
No.
All right, wonderful. I'm not hearing any clicking. And can you do that with your wrist? Just wiggle them around. I'm hearing a little bit of clicking. Feeling a little bit of clicking. But is there any pain with that?
Nope.
All right, wonderful. And then I'm just going to have you do swimming motions with your shoulders, just assessing your shoulders for mobility. So just, front strokes. Wonderful. I'm feeling a little bit of clicking. Any pain with that?
Nope.
All right, and then backwards for me. All right, wonderful, wonderful. And same thing, a little bit of bumps, but you said there's no pain with that?
Nope.
All right, next I'm going to be checking your pulses, making sure that they're symmetrical. So I'm just doing your brachials first. And they are both symmetrical and solid. They're pretty strong. And then I'm going to go down to your radials. There we go. Got both of those. And they are symmetrical and strong as well. So that concludes me checking out your arms. Next, I'm going to move on to your face. I'm going to start by just assessing the symmetry of your face. Just examining, making sure that no bones are out of line or anything like that. And everything appears to be good. Next, I'm going to do a little bit of a neuro assessment on your face. So could I have you smile for me? And frown. And puff out your cheeks. And raise your eyebrows. Wonderful, wonderful. And then could I have you clench your jaw for me? I'm just going to feel. All right, I can feel it. And one more time. All right, wonderful. I can feel his jaw clenching, so I know that that cranial nerve is working. And lastly, I'm just going to do a little sensation test. So I'm going to have you close your eyes. I'm just going to touch a couple places on your face, and I just need you to let me know where I'm poking at. All right?
That's my forehead. That's my right cheek. That's my left cheek. That's my chin.
All right, wonderful. 4 out of 4 on those. So I know that your cranial nerves 5 and 7 are working normally. Next, I'm going to go on and I'm going to assess your hair. So I'm just going to look for any sort of lice, lesions, bumps, moles, anything like that. I'm not seeing any. I'm going to work my way all the way through. Make sure I do a thorough job checking. And I'm going to make my way all the way back to the occipital region. Don't want to miss anything at all. So I'm going through. I'm not seeing anything. Let me just step around slightly just so I can get a better look. You're up a little high. And I'm not seeing anything in the occipital region. And you're not experiencing any pain or discomfort with me going through your hair?
No.
All right, wonderful. And I'm not seeing anything abnormal, so everything's looking good there. And I'm about ready to move on to your eye assessment. So I'm going to have you take off your glasses briefly. And I'm going to be assessing your eyes with this pen light. So we're going to start off just real simple. I'm just going to have you, I'm going to have black my hand and there's going to be a bright light. And I'm just going to check and make sure that your eyes are constricting, okay? So are you okay with me shining the bright light? All right, wonderful. So I'm going to start on the left side or on the right side. And I'm just going to, all right, and that one is constricting. And this one as well. And that one is constricting as well. Wonderful. Next I'm going to do, I'm going to check to make sure that they're equally constricting when I shine the light at the bridge of your nose. So I'm going to do check for equal accommodation. And they are both constricting evenly, which is good. And then I'm going to do the 6 cardinal fields of cardinal gaze. So I'm going to have you look at this pen light without moving your head, and I'm going to move it in a snowflake configuration, okay? Just follow the pen light. All right, wonderful, wonderful. And then the next thing I'm going to have you do is I'm just going to have you touch your nose. Oh, I'll just really quick explain why I did that. So I'm assessing his eyes for Perla, and so they are equal, round, reactive to light, and accommodating. But I just need you to look at this pen light and then look really far away, and I'm just going to ensure that your eyes are accommodating to distance. So look at the pen light, and then at the far away, and then at the pen light, and then at the wall far away, and then the pen light, and the wall far away. And wonderful, you can see him dilate a little bit when he looks further away to let more light. So we know that his eyes are accommodating for distance, which is good. So we know that his cranial nerves 4, 6, or 3, 4, and 6 are working normally. Next, I am going to assess if you can your cerebellar function. So I'm just going to have you touch your nose and then touch this pen light, and then touch your nose, and then the pen light, and then the nose, pen light, nose, pen light, nose, pen light. Wonderful. And then to complete the cerebellar function test, I'm just going to have you make some okay signs with your hands, and then I'm going to have you go to each finger step by step. All right, and then go as fast as you can. Can you do that for me? All right, wonderful. And then I'm going to have you put your hands on your lap, and then I'm going to have you flip them palm up and then down, and then go as fast as you can like that. Wonderful. So that concludes that test. Next, I'm going to go on to assessing your nose. So for this, I'm going to have you look up just slightly, and I'm just going to examine inside your nose for any lumps, bumps, polyps. Make sure it's moist and there's mucus in there, anything like that, and septum deviation. So if you look up slightly, and right now I'm seeing no septum deviation, which is normal, and I'm seeing no polyps. Your nose has mucus, and there's no inflammation or swelling of the turbinates, which is good. After that, I'm going to have you, first of all, do you have any issues with your breathing, anything like that, with either side, any congestion?
No, I do not.
All right, wonderful. I'm going to have you close your eyes for me, and I'm going to get you a smell, and I just need you to tell me what the smell is, okay? And can you tell me what this is?
It's coffee green.
All right, wonderful, wonderful. It is coffee. So we know that his olfactory nerve, cranial nerve 1, is working, which is good. And real quick, let me go back. I just got to assess your sinuses. So I'm going to apply a little bit of pressure to your frontal and maxillary sinuses. And just you let me know if there's any pressure, congestion, anything like that. So on your frontal sinus, anything there?
No.
And then on your maxillary sinus?
No.
All right, wonderful. And then while I'm here, can I just have you look up? I'm just going to assess the sclera of your eyes and then look down. All right, wonderful. They are white and there's no drainage or anything weird coming out of your eyes, which is good. So there's no signs of infection there. Next, I'm going to move on to your ears. And so I'm going to be assessing your ears. So I'm going to start on the right side so you can have a better view. First, I'm going to be checking all around. Normally, if I had an otoscope, I would look in, like deep inside at the eardrum, but I do not. So I'm just going to be assessing the external ear canal. I'm looking behind the ear, making sure it's in line. They're symmetrical on both sides, which I saw earlier. And I'm not seeing any redness, any swelling. I'm looking in the ear canal, seeing a little bit of earwax. That is normal. And you're not feeling any pain when I touch your ear or anything like that?
Nope.
All right, wonderful. And I'm not seeing any bruising or anything. So I'm going to move to the other side. And they both are symmetrical, I can see. And so I'm going to look at this ear. I'm going to look behind the ear as well. Not seeing any bruising, anything like that. I'm also looking in. I see a little bit of earwax. Again, normal. And no bruising or cuts. And you have no pain with this ear either?
No.
And can you hear fine?
Yep.
All right, wonderful. I'll be assessing the rest of your cranial nerve 8 later on with the Romberg. But for now, we know you can hear well. So next I'm going to be moving on to your mouth. So I'm going to be assessing, I'm going to have you open your mouth and I'm just going to look inside, check everything out, okay? So I'm going to have you open your mouth. I can see that your lips are symmetrical, which is good. I'm going to have you, yep, wonderful. And I'm just looking for any lesions, bumps. I'm looking at the palate, gums. I'm not seeing anything. I'm looking at the tongue. Everything looks normal. I'm seeing one minor cut on your lip. Has that been healing fine? How long ago did that happen?
That happened about a week ago.
All right, wonderful. Is that healing very well?
Yeah, it's healing.
Okay. Next, I'm going to be checking your phonation of your uvula, make sure everything rises properly. So I'm just going to have you open up, set your tongue on this, and then I need you to say ah.
Ah.
All right, wonderful. And the uvula does rise on phonation. There's a trash can here. The uvula does rise on phonation, which is good, and it's equal. So next, I'm going to need you to open your mouth, stick out your tongue, wiggle it side to side, left, right, up and down, and swallow for me. All right, and he's been talking this whole time, so I know cranial nerves 9, 10, and 12 are working well as well. So after that, I'm going to start assessing your lymph nodes. So I'm going to start by just palpating your post-auricular lymph nodes behind your ear. I'm feeling for any hard stone-like things, and I'm not feeling any hard stone-like lymph nodes. And I'm going to do pre-auricular, again, not feeling any sort of hard stone-like lymph nodes. And I'm going to go submandibular, again, nothing. Submental, I'm going to work my way down your cervical chain. All right, and then I'm just going to loosen this slightly so I can assess your supraclavicular lymph nodes. I just need it to be a little bit looser. Is that comfortable with you?
Yep.
All right, wonderful. Can I have you shrug your shoulders slightly up? All right, and I'm going to reach down in here. I'm assessing your supraclavicular lymph nodes. Not feeling anything abnormal with them. And then after that, I'm going to check your tissue turgor. So I'm going to do a little tenting test right here on your clavicle. No tenting there, which is good. So everything's looking good there. Next, I'm going to look at your neck. I'm inspecting for trachea alignment. I'm not seeing it shoved off to the side, which is good. And I'm also going to assess for your carotid pulses. So I'm going to palpate the right side. And that is strong. And then I'm going to palpate the left side. And that is also strong. Next, I'm going to listen to both carotid arteries with the bell of my stethoscope for bruise. Put the stethoscope on, and it's set to the bell. Set to the bell. And next, I'm going to listen to your right carotid artery. I'm going to need you to hold your breath slightly for like a couple of seconds while I take a listen. All right? And I'm not hearing any swooshing on that side. You can breathe normally now. And then I'm going to go to the left side, and I'm going to listen to this one as well. Again, not hearing any swooshing, which is good and normal. And that concludes my section of the front of your body. So I'm going to move to the back, and we're going to begin assessing the back of your body. Real quick, I'm just going to check my paper. So starting from the back, I'm going to come around back, and I'm going to expose you a little bit. Are you comfortable with me opening up your back a little bit?
Yep.
All right, wonderful. So I'm just going to be looking at your back. I'm noticing you have a little bit of acne. I'm not seeing any cuts or anything like that. Has the acne been bothering you at all?
No.
All right, wonderful. I'm looking at your spine, and I'm noticing that it is indeed curved laterally with scoliosis, which is to be expected. And then lastly, I'm just inspecting for any cuts or anything like that, which I do not see. So first, I'm going to start by checking for even expansion of your chest. So I'm just going to put my hands gently on your back. I'm going to roll. Could you posture up for me slightly? All right. And now I'm going to have you take a deep breath. And you can exhale. Wonderful. And they are expanding evenly, which is good and normal. Next, I'm going to palpate your lymph node for any enlargement of your lymph node, just to make sure that it's not enlarged. So I'm going to be reaching around your neck to your trachea, and I'm going to be gently deviating to the side. All right. And I'm not feeling any enlargement there, and you could show that from the front if you'd like, just so that way they can see. So I'm coming around and just gently on the trachea, I'm going to deviate to the side. I'm not feeling anything abnormally large there. All right, wonderful. Now we can go back to the back of the camera. Next, I'm going to percuss the lung fields, and I'm going to do this in the half crescent shape, starting and alternating like a ladder down. All right, I'm going to start here. And everything is sounding good. I am hearing a resonance, which is normal. Next, I'm going to auscultate each lung field 6 times on each side, and halfway through, I'm going to ask you if you need a break, and anytime in between, if you need a break, you just let me know. You raise your hand or something like that, and I will give you a break. All right? Mm-hmm. Okay. Start here. I'm going to need you to take a deep breath. I'm listening for any wheezing, cracking, crackles, anything like that. So far, so clear. And do you need a break at all?
No.
All right, wonderful. Got these last 6. All right, wonderful. And I'm hearing no abnormal noises. Every lung sounds clear and symmetrical, which is good. Next, I'm going to tie you back up. Just on the bottom for now, because I'm going to have you lay flat. I'm ready for you to lay flat, and then I'm going to begin the cardiac assessment, okay? So
Mhm.
I'll tie this as best as I can. And you may lay down, and while you lay down, I'm going to glance what I got over here. Alright, wonderful. Now I'm going to begin with the chest assessment, so do you mind if I gently uncover your chest?
Nope.
Alright, wonderful. And this is a little stuck. Sorry.
You're fine.
Here, I think it. Can you sit back up on this for a split second? Yeah, it's okay. Okay, you may lay down now. That was weird. Alright, wonderful. I'm just gonna uncover your chest. You okay with that?
Mm-hmm.
Alright, wonderful. We're gonna go down. And perfect. I don't want to expose too much. Alright, first I'm looking for jugular vein distension, and I'm not seeing any so far, but can you look towards me? Alright, wonderful. And I'm looking at the other side. Can you look the other way? Wonderful. I'm not seeing any jugular veins popping out, which is good. If I did, I would raise you up and just double check that I'm not seeing any, but I'm not seeing any, so that is good. Next, I'm looking at your chest. I'm seeing a couple moles. Nothing of concerning, no weird cuts or bumps or anything like that. So everything's looking good there. And are you having any chest pain at all?
Nope.
All right, wonderful. So I'm going to begin auscultating your heart sounds in the ape to man pattern, starting on your right side with the aortic valve. So, and I'm going to be listening with the diaphragm and the bell. So starting, you're going to have to get close for this, like right over top. Because like you have to show like straight up and down. Okay, so starting here on your clavicle, on your right side, I'm gonna go down, I'm gonna find your first rib, and then I'm gonna go into your first intercostal space, and then your second rib, and then your second intercostal space. And I'm gonna set my stethoscope right there for the aortic valve. And I'm listening. It was on the wrong one. Now it's on the bell, or the diaphragm. And I'm hearing that normal lub dub that I'd expect to hear. So I'm going to listen, keep my hand there to make sure I don't lose my place. And I'm going to listen with the bell for any murmurs. I'm not hearing any murmurs, which is good. So we're going to move on to the next one over here. On your left side, we're going to start from the clavicle again. We're going to work our way down, find our first rib, first intercostal, second rib, second intercostal, and we're going to have a listen with the diaphragm in the pulmonic valve. Hearing that normal lub dub as should. I'm going to keep my finger there to hold my place, switch around to the bell, and listen for any murmurs. I'm not hearing any murmurs. Put my finger there to hold my place, go back to the bell, and I'm going to go right over this next rib into the third intercostal space, and I'm going to listen to Erb's point. Hearing that normal lub dub, and I'm going to switch over to the bell again, and I'm going to listen for murmurs once more. I'm not hearing any murmurs, which is good. Keep my hand there to hold my place. I'm going to go down one more rib on the fourth rib, and then to the fourth intercostal space, and then I'm going to listen with my diaphragm once more. So I got it on the diaphragm and right there. Everything is sounding normal lub dub. I'm going to switch to the bell and listen for any bruise once more. Not hearing any bruise, so we're going to go down one last rib down to the fifth intercostal right here, and then we're going to slide mid-clavicular right to there, right mid-clavicular on the fifth intercostal, and then we're going to have a listen here with the diaphragm. To the mitral valve. And again, this is the loudest spot in the body, so it's very prominent to hear. And now I'm going to listen with the bell. I'm not hearing any bruise, so I'm going to go back to the diaphragm and I'm going to count the apical pulse. I actually just lost it, so we're going to work our way back down again. So we're going to start here, first rib, first intercostal, second rib, second intercostal, third rib, third intercostal. Hold on. First rib, first intercostal, second rib, second intercostal, third rib, third intercostal, fourth rib, fourth intercostal, fifth rib, fifth intercostal, and we're going to work our way along the side and listen right there for 60 seconds, so to count the apical pulse. I counted exactly 62 beats in that minute, which is normal, so everything is sounding great there. And now I'm going to cover you back up. That concludes the chest assessment. All right. Next, I'm going to go on to your abdomen. Are you okay with me uncovering this way, or do you want a blanket underneath?
I'm fine with you uncovering this way.
You're fine with me uncovering?
Mm-hmm.
All right, wonderful. I'm going to slide this up just right to your rib cage. All right. And we're going to begin the abdomen assessment. First, I'm going to start off by just examining your abdomen, looking at symmetry. I see the aortic pulsing, which is normal. Looking for anything poking out at me. I see one mole. Everything else is fine. Everything's fine. So I'm going to begin by auscultating and listening to your bowel sounds until I hear at least 5 in each quadrant. Normally we do it for a whole minute, but just for sake of time, I'm going to listen for 5 in each quadrant. I'm going to start in the right lower quadrant, and I'm going to work my way around clockwise from my perspective, counterclockwise from yours. With the diaphragm, we'll start here. And I heard 5 vowel sounds there. I'm going to move up 1 quadrant. Five vowel sounds there. 5 bowel sounds there. Five bowel sounds there. So bowel sounds are active in all 4 quadrants. Next, I'm going to take a listen for any bruits in the abdomen arteries. So I'm going to start at the bottom of the xiphoid process. I'm going to go mid in between, exactly between the belly button, and I'm going to listen with the bell for any bruits. I'm not hearing any there. And then I'm going to work my way to the renal arteries, making the house shape. Not hearing any there or there, which is good. Down to the iliac arteries. No bruit there, no swooshing. None on this side either, which is good. Next, I'm going to percuss your abdomen. Just make sure everything is sounding full of tympany and normal. So I'm going to start in the right lower quadrant. I'm going to make little triangles going all the way around, and then I'm going to assess for your liver border. So I'm going to start here. I'm just going to do a little percussion, okay? All right, wonderful. And I heard tympany. And now I'm going to work my way up and make sure I can hear the liver to assess if it is enlarged. All right, and just a ½ an inch under your rib cage as to be expected, which is normal. So everything is looking good, sounding good, and I'm going to begin to palpate your abdomen, okay? So sorry if my hands are a little cold, but I'm going to start with light palpation. I'm just going to work my way from the right lower quadrant all the way around, and you just let me know if you're in any pain or discomfort, okay? So I'm going to start here. Any pain or discomfort?
Nope.
Any pain or discomfort?
Nope.
Pain or discomfort?
Nope.
All right. Any pain or discomfort?
Nope.
All right, wonderful. And now I'm going to do some deep palpation, so it's going to be a little bit more pressure, all right? And you just let me know any pain or discomfort, anything like that. And I'm going to be feeling for any like bumps or anything underneath the skin, all right? No? No pain? All right.
No.
All right, wonderful. So that completes our abdomen assessment. Next, I'm going to move on to your femoral arteries. So I'm going to assess your femoral arteries and listen for any bruits. So for this, I'm going to, actually, it might be best if you slide down just a little bit. All right, wonderful. And then I'm going to have you bend your legs slightly. All right, and we're going to be going, if you come around, we're going to be assessing right in between where his legs bend. His femoral arteries will be right there when he straightens his legs. So I'm going to reach down and feel that both are symmetrical and powerful. And then I'm going to listen for bruits, all right? So I'm going to go down, and you can straighten your legs. And I can feel that both are powerful and symmetrical, which is normal. And next I'm going to take out my stethoscope and listen for any bruits on either side. So I have it set to the bell. Now I have it set to the bell. It's getting a little twisted, and we're going to go underneath and listen for any bruits. I'm not hearing any swooshing on this side, which is normal. And then on this side, I'm going to do the same. I am again not hearing any bruise, which is good. And that concludes that section. So now I'm going to move on to your legs, okay? So we can cover your abdomen back up. Sorry for exposing you like that. And now we're going to move on to your legs. So I'm just going to take a look. I'm going to be inspecting your legs, just looking for any lesions, bumps, cuts, abnormal things. I'm just looking around, not seeing anything. I'm looking at the bottom of your feet, making sure there's not any hidden cuts down there. Still not seeing anything, which is good. And next I'm going to palpate each leg, feeling for edema and temperature. So I'm just assessing for any fluid, anything like that. I'm not feeling anything, which is good. Next I'm going to check cap refill down at his toes. So I'm just going to do a couple toe cap refill checks. And down here it is 3 seconds on that left foot. 2 seconds on this one. Okay, let me double check this one. Oh, they're pretty fast. 2 seconds on both sides. All right, and next I'm going to palpate each one of your arteries. So I'm going to start with your popliteal arteries, make sure that they're symmetrical and I can feel them. And down in here, got the right side, and there's the left side. And they are symmetrical, and they are pretty faint, but actually pretty strong for popliteals. Normally they're more faint than that. Next I'm going to go onto your tibialis anteriors, which are going to be on the insides of your ankles. I'm going to be assessing for symmetry. And both are strong and symmetrical, which is to be expected. Now we're moving on to the dorsalis pedis, so we're going to be checking those. There we go. I could feel it on the left, but not the right. All right, and those are symmetrical and even. Next, I'm going to do a little sensory test on your legs, okay? So I'm just going to have you close your eyes, and I'm just going to be poking, and you're going to tell me where it's at and whether it's sharp or dull, okay? Yep. So I've got this right here. Can you tell that this is sharp?
Yep.
All right, and that doesn't hurt at all, does it?
Nope.
All right, wonderful. And then this is dull?
Yep.
Can you tell the difference between sharp and dull?
Yep.
All right, wonderful. So we're going to do 8, and you're just going to let me know whether it's sharp or dull and where it's at, okay? All right.
That is on my left thigh, and it's sharp.
Wonderful.
That is on my right thigh, and it is dull. That is on my right kneecap, and it is dull. That is on my left kneecap, and it is dull. That is on my left shin, and it is sharp. That is on my right shin, and it is dull. That is on the bottom of my right foot, and it is dull. That is on the bottom of my left foot, and it is dull.
All right, wonderful. And you passed with 8 out of 8, so that is perfect. You have perfect sensory in your legs, so I feel comfortable sitting you up. Okay, so you may sit up off to the bed right here, and we're gonna do a couple more assessments. All right, so first we're gonna start off with a little bit of range of motion. So I'm just gonna have you. Let me help you tie that. I don't want to leave you exposed. So far we've assessed all of your cranial nerves except for number 8. We've done your shrugging when we did tissue test, Turger test. We did, which is cranial nerve 11. We did 1 with the smell. We did 3, 4, and 6 with the eyes and the perla, and then we did number 5 and 7 with your face and the sensory on it, and then we did numbers 9 and 10 and 12 with your mouth. Right, so now we're going to move on. We're just going to finish off number 8, but before I can do that, I got to assess your legs, make sure that they're structurally sound. So I'm going to be assessing the mobility And I'm just going to be listening for any crackling or popping. Can I have you move your knees for me? All right. And is there any pain and I'm not hearing any popping, but is there any pain with that one?
Nope.
And then with this one? All right, wonderful. No pain with that?
Nope.
Okay. And with your ankles, can you do them? Wonderful, wonderful. All right, now I'm going to do a little bit of resistance pushing. So I'm going to just have you fight me on there, all right, and then fight me back, and then up with your foot, and then down with your foot, and then out to the side, and then inside, and then with the other leg. So now you fight me with this one, and then fight me back, and then have you push up, push down, push in, and push out. All right, and then with your hands now, I'm going to have you push down, all right, and then push up, and then push in, out and then in. Wonderful. Next, I feel comfortable with your strength. I'm going to give you your shoes. Wherever your second shoe went, here's your sock and your shoe, and I'll find your second shoe. And I'm going to assess your gait. Let me find that shoe. Oh, it went under the bed. There we go. And there's that second sock for you. We're just gonna have you put your shoes on, and while you do that, I'm gonna go check my little list one last time. All right. Getting your socks on okay?
Mm-hmm.
All right, now before you stand, let me just do a quick check of your patellar reflexes. This is just basic protocol. So right here, and boom, that one's kicking, and boom, that one's kicking too. Perfect. All right, so I'm about ready to assess your Romberg. So I'm gonna have you stand up now that your shoes are on. Wonderful. And I'm gonna have you, just making sure you're not exposed to anything. And I'm gonna have you stand still with your arms slightly away from your side, with your eyes closed for 10 seconds, okay? All right, wonderful. That is a negative Romberg. He is not swaying like crazy, so I feel comfortable assessing your gait. So next, I'm going to have you walk with me. I'm gonna have you walk this way. Actually, we'll have you walk this way through the light, and I'll stand beside you. Okay? So we're gonna come this way, and I'm gonna be right with you just in case you fall. There's not much room. Just walk normally. Wonderful. And I'm gonna have you turn around. I'm gonna have you walk heel to toe. Okay, perfect. And I'm walking with you, making sure you don't fall. All right, wonderful. And you may sit back down. All right, and that concludes our head to toe. You passed with flying colors. I'm gonna give you a Braden scale of 23 because I didn't see any moisture. I'm not worried about any friction or shearing. You have a very good nutrition. Your exercise, you're mobile, you exercise a lot, and so I'm going to give you a Braden scale of 23. The end.